Good afternoon, everyone, and welcome to Black Health Trust. I'm Barbara Neighbor Stevens, one of the co-moderators that has the pleasure of welcoming you today to our very vigorous discussion of vaccines. Are they working? Are they worth it? Black Health Trust explains breakthrough infections and how to protect your family. Dr. Randall Maxey, Dr. Ivan Walks, and I are joined by our distinguished guests today, Dr. Virginia Kane and Dr. Janine Daly-Garnes. Without further ado, I will turn it over to Dr. Maxey.
Thank you very much, Dr. Barbara Neighbor Stevens, and thank you very much, Dr. Ivan Walks, for joining me as our co-moderators. And I give special thanks to Dr. Virginia Kane and Dr. Janine Daly-Garnes, our guests for today. And our format's going to be slightly different. We're going to have a number of questions pitched to each of our guests and the moderators as well. And you're also invited to put questions in the chat. We know that this week we have learned just how devastating this new variant is, the Delta variant. We've also heard about a number of other variants making their way from whether it be India, South Africa, Peru, Brazil, into our midst. And there's some controversy over people who don't see the need to protect others. So we're going to discuss all of those, and we know there's been many questions, and we're going to go right to them. I'm going to call on our producer, technical producer, Mr. Simon Cooper, who has the first question. Mr. Cooper.
All right, first question. My mother was fully vaccinated and now has COVID-19. I was told that this is a breakthrough infection. What does this mean? Does that mean we will all get sick?
Dr. Kane, maybe you can handle that first question.
Okay, so, I think at the beginning, people have sometimes made the mistake that the vaccines are 100% protective. And actually, we don't have any vaccines that I'm aware of that's 100% effective. And if we realize if your mom had the Pfizer vaccine or Moderna vaccine, it was considered to be 95% effective. That meant that if 100 people were vaccinated and were exposed to a virus, only 95 out of the 100 had enough immunity or protection to prevent an infection. So what that meant was that now, because we have a totally new strain versus what the vaccine had been developed for, your mother became infected probably with a Delta variant, and as a result became infected. But now the good news is that your vaccine has enough antibody or immunity to protect her from getting a very severe infection. It may not allow her enough protection to prevent the infection completely, but it allows her to not to have a very severe infection where she's being hospitalized and in a critical care unit, or she could be at risk for life-threatening illness. And it usually implies that if she's exposed and has had this breakthrough infection, it's usually associated with milder symptoms or maybe no symptoms if she gets this particular breakthrough infection. Now, does that mean that we all will get sick? That's an excellent question. What we're finding out now is that the individuals who get a breakthrough infection, although it is very rare, less than 100% of the infections occurring today are breakthrough infections. We now are finding out that if it's the Delta variant, people who get infected now are found to have a very high viral load, meaning that this individual has a lot of viruses despite the fact they have a vaccine. And because their viral load is so high, just even speaking normally can cause respiratory droplets that can get out into the air. So they now feel that these breakthrough infections can transmit the COVID-19 infections to others. So that if you have children in your household who are not eligible for the vaccine, or you may have someone that's immunocompromised or high risk in your household, you can spread that infection to those individuals in your household. And you need to take the necessary precautions to prevent it.
Dr. Kane, thank you. Would you be kind enough to introduce yourself?
Oh,
in a
sorry.
brief
So,
introduction?
yeah, so I'm Dr. Virginia Kane. I'm Director and Chief Medical Officer for the Marion County Public Health Department, which is the health department for Indianapolis, Indiana. I'm also an Associate Professor of Medicine, Division of Infectious Diseases at the Indiana University School of Medicine. And I also chair the Infectious Diseases section for the National Medical Association, which is the oldest and largest Black physician association in the country, while being also the member of the National Medical Association's COVID-19 task force.
Well, thank you so much. And before we go to our next question, I'm going to ask Dr. Naybert if she would briefly review the statistics that we have for today.
I'd be happy to review the statistics, although I'm afraid I'm still the bearer of bad news. Can we have that first slide, Simon? Unfortunately, we are still seeing a rise in cases and deaths, with the total US cases now approximating 34 million, really knocking on the door of 35 million. Total new daily cases as of last night were 101,171, and deaths 610,873. The total number of vaccine doses so far are 345,640,000. Of particular note, next slide, please. I want us to pay attention to the fact that according to our CDC data, as far as the impact of COVID on African Americans, we are now representing 11.4% of all cases. We are representing 13.7% of all deaths. And I'll remind you that we are approximately 12.5% of the total US population. In terms of rates of vaccination, we really haven't budged much. We still have only about 9.5% of African Americans having received at least one dose. But maybe a little glimmer of hope in this is the fact that 15% of those actually received those first doses in the last 14 days. We only have 9% of our African American population fully vaccinated. Clearly, we still have a lot of work to do. And I think as you hear the questions and discussion today, you will identify really positive things that you can do to protect yourself and your family. Thank you. I think now we are ready for our second question. And our second question is going to be posed by our co-moderator today, Yakini Stevens. And this question will go to Dr. Daly Garnes.
Dr. Garnes, could you please tell us, how do I know what to believe, what that comes from the media?
So this is it's a very interesting question. It's a very timely and a very challenging question. And, you know, the thing is that there are so many different media outlets, and we really have our choice of what news we take in at this point. So knowing what's believable, I think we have to think about what our source is. And there's a lot of opinion out there that is coming across as media, but we really need to go back to falling back on the science. And so, what is the source for information? So I know there has been a lot of distrust that's come in part because of the uncertainty associated with this pandemic. And we may get into that more later, but things, information that is coming from the Centers for Disease Control is reliable. It takes them time to gather the information, but they do a very good job of vetting that information before they disseminate it. Information that's coming from the National Institutes of Health, information that's coming from academic institutions across the country is generally reliable. But one way to evaluate that reliability is to compare, if you're looking at different sources of information that appear to be reliable, are they saying things that are compatible with each other? If you're reading something that is completely different than everything else that you're seeing, I would call that into question. And that doesn't necessarily mean that it cannot be relied upon, but I would take it with a grain of salt and gather more information before deciding that you're going to move forward with acting on that information.
Dr. Garnes, before you briefly introduce yourself, are there several sources that you would suggest that we get our information from? And then Dr. Walks is going to introduce the next person for a question, but tell us who you are very briefly.
So in terms of other sources, the National Medical Association is also a great source. Your personal physician or care provider that you have a relationship is also a good source. So those are all people to talk to. So I am an adult and pediatric infectious diseases specialist in Houston, Texas. I'll leave it at that.
Well, thank you so much. Dr. Walks?
Thank you, Dr. Daly Garnes. I just want to make a quick little statement that it is really wonderful that we have the level of expertise from Dr. Kane and Dr. Daly Garnes available here on the Black Health Trust. So I want to thank you both for bringing that level of scholarship and that level of concern to what we're trying to do today. Our next question again comes from Yakini, and this is one I think all of us maybe struggle with. And I'll give it to Dr. Kane first. Dr. Kane, why does the news, I'm sorry, I'm going to ask Yakini to ask the question. Go right ahead, please.
Well, thank you so much. And before I ask the question, I did want to ask Dr. Walks if you could maybe help us understand, how does Black Health Trust get their information? You all have been a source of information since day one for a lot of us, and we rely on that. And could you explain to our audience how you all vet your information?
So thank you for that, Yakini. Even though it's not a question I'm prepared to answer, I'm happy to answer. The Black Health Trust, we do what a lot of folks do. We look around at what's in the media. We tend to look at places like the places Dr. Daly Garnes just mentioned. Dr. Maxey does that. Dr. Nabrit Stevens does that. I do that. We look at major outlets like the New York Times and other places. Sometimes we watch Fox News. We'll look all over the place to find what's in the media, what are people concerned about. And then we have our other meetings, not just on Sunday, but we have meetings during the week where the folks who come together to help make up the Black Health Trust talk about these things and sort out where can we go. For example, the places Dr. Daly Garnes talked about, to the NIH site, to the CDC site, so that we're getting current scientific information. And then we will form work groups of doctors that are really, really smart, like Dr. Kane and Dr. Daly Garnes, who have all of these wonderful credentials and also really care about what's happening in our community. And these folks will help us with putting together task forces. For example, I chaired the task force on the vaccines and trying to figure out how would the Black Health Trust make a statement about the vaccines. So just in brief, we went through what came out of the FDA, we went through what came out of the National Medical Association, and our task force included a lot of very, very smart people with a lot of very, very smart degrees, including MDs and PhDs and other folks. And so then we decide, what do we present as trusted health information for communities of color, primarily the African American community, so that we can actually live up to the name Black Health Trust. We want folks to know that the information we're giving is not because we're trying to get likes, not because we're trying to get someone to subscribe to our page, not because we're trying to monetize the Black Health Trust, because none of that is true. We all serve on other not-for-profit boards, and our credibility matters to us. And so when we come on the Black Health Trust and we say something, it's scientifically vetted, and it's information that we believe you can trust. And it's information we share with our families as well, because we want to keep as many people healthy as we can. So I hope that gets to the answer for your question, Yakini, about how the Black Health Trust comes to the opinions that we present and comes to the information that we present.
And let me just add to what Dr. Walk said. And we have some very vigorous meetings among the moderators and our medical advisory committee. And we meet at least monthly, sometimes more. And the debate is vigorous with a capital V to make sure that we present what is the most possible and credible information that we can every Sunday. But go ahead with your question.
Thank you so much. Dr. Kane, why does the news about COVID-19 keep changing?
The reason why it keeps changing is that we have a virus that is constantly evolving. It's very dynamic. It doesn't stay the same. So we're looking at this COVID-19 virus strain. It is not the same strain we faced last year that first came on the scenes in this country. And so certain coronavirus strains, they have a certain virulence, a certain contagiousness, or how deadly they are. And so just 2 months ago, we have been seeing some newly mutated strains. And 2 months ago in the United States, the predominant strain was a strain called the Alpha strain. It reflected a strain from the United Kingdom. And from what we could tell is our vaccines are very effective. We also had a few breakthrough infections, but none of those infections seemed to be able to transmit infection. It was very low to transmit infection. So we thought we were very comfortable with the recommendations that CDC did about 2 months ago, when it said that if you're vaccinated, you don't require any masks. And look what was happening across the country. There were very few cases had dropped dramatically. Hospitalizations had dropped. We were no longer filling our critical care emergency room beds. And so we felt very comfortable about that recommendations from the federal government. But just in a 2-month time frame, just 2 months, the Delta variant strain, which is way more contagious than any of the strains that we have seen before, it is mutated sufficiently enough that it's more hardy, that it has now become the predominant strain. Almost 90% of the new cases occurring in the United States now are this Delta variant strain, and it's more resistant to the current vaccines that we have. And although our vaccines are very effective against this particular strain, it is not 100% and was not as good as what we saw for the strain that we first started out with this epidemic. So you have to be able to be flexible. You have to be able to adapt with the evolving changes occurring with this virus. It's like you've been in the war of the military. You just don't have the same tactics at the start of the war. It changes as time goes on. And so we have to adapt and have new strategies as it occurs. And so that's why our news about COVID-19 keeps changing. We saw an outbreak, for example, just recently in Provincetown, Massachusetts, where this is a small town in Massachusetts. They hardly had any new cases to July the 4th. but they had a festival that occurred in that town. And as a result, they had a Delta variant outbreak, and they had as much as 470 cases occur, new cases from the outbreak within 1 month. And they found out that 75% of those people infected had been vaccinated. So this is when they were able to determine that, wow, these vaccines may possibly be able to transmit infection if they've had a breakthrough infection. So we are learning every day. We're following the science. We're continuing to monitor trends and also understand what's happening from other countries to give us some insight what could be happening or occur with us here in the United States.
Thank you so much, Dr. Kane. Let me use executive privilege. I think there's one of our frequent attenders, Admiral David Brewer. If Admiral Brewer is on, can you unmute him? He sent a comment that I'd like him to put that in the form of a statement, a question to our two experts on the line. Is Admiral Brewer on?
Yeah, I'm here. I'm here. I just had a cousin whose 11-year-old daughter was just infected with COVID-19. So the first question, I'm a biology and chemistry guy and a disciple of Dr. Maxey. And I spent a lot of time on Black Health Trust, so I have a fairly decent understanding of COVID-19 and its treatment. So the first question I asked her was everyone vaccinated in the family, and were you masked? And she said yes. So the next question I asked is, did anybody in the family test positive? She said no, everyone was negative. So that child, 11 years old, contracted that virus somewhere else. And so my commentary on LinkedIn and Facebook, et cetera, has been the following: that our children, 11 years old and younger, are very vulnerable to this virus. So how do we protect them from this virus since they cannot be vaccinated? And we've got all of these unvaccinated people and vaccinated people walking around not wearing masks. And of course, I use the example of New Zealand, which has 5 million people, same number of people as the state of Georgia, 26 deaths, no vaccine yet. They just got Pfizer in July. But they were aggressive in wearing masks, etc. And they had 26 deaths to date, and Georgia has had over 20,000.
So just before,
I'm saying, how do we fix this?
so just before Dr. Kane and Dr. Daly going to answer your question, what was your command when you were an admiral in the U.S. Navy?
Okay, I commanded 2 ships, a group of 17 ships, and a fleet of 126 ships. And it was interesting that I've read that you made the war analogy about tactics. I took over my last command 12 days before 9/11. And that's when the war on terrorism's tactics changed. We used to be able to walk to the airplanes. We couldn't do that anymore. And that's what this whole Delta variant is about. This is a 9/11. And that's my analogy about the Delta variant. And we've got to make the change. We can no longer walk around without masks. It's like we can no longer walk to right up to an airplane and say goodbye to our relatives as they leave. So I don't know what the answer is. But,
I'm going to ask Dr. Garnes and Dr. Kane to address that.
Well, I think first I want to acknowledge that Zealand was a unique country and that they had very strict risk mitigation strategies that they put in place, stricter probably than any other country in this global world. And they made it last for a significant long period of time, and very strict about allowing any visitors to come into their country. So that's why they've been able to get such a phenomenal, strict control of their country. And they didn't have the same politics that we have in our country, so that from from a nationwide standpoint, they were able to put in mandatory type of restrictions where here, decisions could be made state by state, and depending on sometimes the political implications made a difference about risk mitigation. For example, some states now, such as for my state in Indiana, we're not even allowed as government officials to do a vaccine passport. So I can't ask people or make cards available to them to say that you've been vaccinated. So Zealand didn't seem to have those kind of problems. So that's the first thing. But let's talk about can we protect our children who are unvaccinated. You have to understand that I think now, key thing is if you're in indoor settings, they should be masked regardless of their vaccine status, because we can have breakthrough infections. We also know the Delta vaccine is occurring in a much younger group now. Now, whether that's related to we have a higher number of our seniors vaccinated compared to our younger group or younger populations, that may be part of it. But you have to know that everyone living in that household with that child needs to be concerned about, could they get an asymptomatic infection, meaning they can be infected, but not be aware that they're infected. And that's what we're seeing a lot with this COVID-19 infection. And then when she returns to school, what are the mandates? What are the recommendations to safeguard her? Is she wearing masks in the schools, regardless of the vaccine status? Is she cohorted, meaning that she's only sitting with the same students? She's not exposed to a large number of students every day during the course of the day. And are the teachers, are they vaccinated in the staff that's dealing with her, where she's spending maybe 6 to 8 hours a day? These are critical questions we have to ask, and this may shock you. I'm going to tell this as a shocker to you. We have a lot of parents that have children who are vulnerable. They can't get vaccinated, and the parents have made a conscious decision they are not vaccinated. So let me say this again. We have parents who could protect their children who decide not to be vaccinated, okay? And they can put their children at risk because they can have no symptoms. They won't even know they're infected. And they can be exposed to that child greater than 15 minutes during a 6 feet time frame and not take the necessary protection to protect their kids. That's the frightening thing, I think, for all of us.
Dr. Garnes, do you have a comment on that?
I would say definitely going back to the state issue that Dr. Kane brought up. As I mentioned, I'm in Texas. So our governor actually made a rule that no government organizations across the state can require mask wearing. That includes our school districts, our public school districts. And I have young children that are too young to be vaccinated. And so I have concerns, what can I do to keep my children safe? And so, one of the things I think it's important for us who care about the health of our children, the health of our community, to speak up to our local officials, to our state officials, and tell them what's okay and what's not okay. There is no child in an elementary school that is old enough at this time to be eligible to be vaccinated. And so to give the freedom of not being, not requiring mask wearing in that setting is definitely setting our children up for being at increased risk. And we know that with the current state of this pandemic, with the Delta variant, our children, although they tend to have milder disease, there are more children in the hospital sick with COVID right now than there have been during this entire pandemic. The number of hospitalizations among children is in the 20% range. And that's new. That hasn't happened before during this pandemic. So it is very important that we brought up this point. And what I would say is we have to do what we can do. And that means that those of us who can be vaccinated, we should get vaccinated, because that's one way that we can protect ourselves and we can protect those around us. 2, we should continue to wear our mask. So as Dr. Kane pointed out, so personally, I've been vaccinated, but we now know that just because I've been vaccinated doesn't mean that I can't still get COVID and that I can't still transmit it to my unvaccinated children. And in addition, I would say if there are people in your household whose immune systems are not working well, people who may have lupus and are on serious medications, people who have undergone transplant, people who have cancer and are on therapy, even if they've been vaccinated, we don't know how well the vaccine is protecting them. So if I'm going out into the community and I know I'm coming home to people that are vulnerable, I still wear my mask, regardless of what has been said about, fully vaccinated people don't have to. I still wear my mask, one, because I want to model it for my young children, because they need it in order for them to be protected. And 2, because I don't want to bring anything home to them. Like, I'm working with patients with COVID. So it's very important that I take precautions to protect myself so that I can protect the folks that I love. And so that being said, we need to continue to wear our masks. As Admiral Brewer said, we need to continue to practice distancing. And, we want to be there. We want to be on the other side of this pandemic, but we're not there yet.
Thank you so much.
Thank you very much, Dr. Daly Garnes, and thank you, Dr. Kane. I think it might be useful to also point out that, Dr. Kane, you had some job at the American Public Health Association too. Oh, that's right. You were the president.
Just past president now. Thank you. All the same.
No, I mean, I always like to know who is giving me public health advice. And so it's nice to know that I'm getting public health advice from folks like Dr. Daly Garnes and folks like Dr. Kane. Their credibility matters. And I think it does matter that we point out those things. One of the other questions from Simon, if you could ask the question about the vaccines. The next question, please.
Yes, is the vaccine safe? It's not FDA approved.
So who wants to answer that question? So let me just, I'm sorry,
go ahead, Dr. Kane. You can jump right in.
Let me just say, there's been more than 3.6 billion COVID-19 doses that have been administered across the world. Let me just say this again. 3.6 billion doses have been administered across the United States. The data confirms that the vaccine is safe and effective, and it has protected vaccinated individuals from contracting the virus. It's lessened the symptoms considerably in the rare cases where those who are vaccinated do test positive. And so based on that data and the extent that we've used this vaccine and the tremendous amount of lives we have saved, we're confident that the benefits of this vaccine outweighs any risks with this COVID-19, and that vaccination is the clear path for all of us out of this pandemic.
Dr. Daly Garnes, anything to add?
I mean, I agree with Dr. Kane. We have probably more data, even though it's been a short period of time, we have more data on more people. There is nothing that we put in our bodies that does not have risk associated. That includes food, that includes drink, that includes natural herbal medications. Everything has a risk. And so, yes, we have identified some things that have occurred with the vaccine, but overall, the vaccine is safe. The vast majority of the people who have been vaccinated have not experienced severe side effects.
So I just want to stay on this for a while, because this is one of those things that folks really jump on. They'll say, well, it's not FDA approved. Well, I don't know if anybody on this call has ever tried to get something FDA approved. It's not something you do in 6 months or 12 months. it takes a long time. And I think somehow equating the question of, is it fully FDA approved with the safety of the vaccine, it's, what do we used to call that? A red herring? It's something that people throw out, but it doesn't really have the same meaning that folks may think it has when they hear that. Is that a fair thing to say, Dr. Kane?
I think that's true, but I think people want to understand to this. The FDA has approved it under emergency order. It just hasn't received the final and full FDA approval, but it's undergone rigorous testing where they had to look at least a minimum of about 30 to 40,000 people on this vaccine before they allowed to get the emergency authorization. The second thing I want to have to emphasize is that they were able to cut out a lot of the bureaucratic logistic applications to this approval process that would take a long time and nothing to do with the vaccine itself. They were able to speed up a lot of the processes and reviewing this data that they would otherwise not do. And so they were able to cut out the bureaucratic kind of logistical nightmares in getting a vaccine approval process approved. But they did not shortcut any of the critical components of getting a vaccine approved.
And Dr. Daly Garnes, let me just ask you to follow up on this particular question, because a lot of folks at the beginning of the vaccine rollout said, oh, wait a minute, I'm going to wait and see because they just put this out. But Dr. Kane told us hundreds of millions of doses have already been given. So did they just approve this and just walk away and said, okay, we're not going to look and see what's happening. We're just going to approve it. Tell me a little bit about what's been happening since that emergency use authorization.
And that was actually one of the points I was going to make, is that, we had these 30 to 40,000 that were tested before the emergency use authorization was released, but there's been ongoing monitoring continuously since that time. So for many of us who have been vaccinated, there's an ongoing vaccine safety program that is run by the CDC for all vaccines, and the COVID-19 vaccine has been included within that program. But something new that was done with this particular vaccine was that they also started this app called Be Safe, where they would send you a push notification through your phone daily for the first few days, and then weekly to monthly after your doses of vaccine, so that they could keep close tabs. Because it's true that there are some adverse reactions to a vaccine that you really can't identify until you've got massive groups of people who have received it, which means that those are very, very rare events. But there has been ongoing vetting. And that is part of why, getting back to a previous question, where we're constantly getting more information. Because as we're doing this ongoing surveillance, we're developing a new understanding. Okay, there are certain side effects that we may see in certain patients with the vaccine. But this is just a fact. This is how we make sure that vaccines are safe in this country. We don't just drop it at the authorization or even at the approval stage. Even once it is fully FDA approved, that process will continue.
Thank you so much, Dr. Daly Garnes. I think we have another question coming from Yakini.
No, it's actually Simon.
Thank you.
All right. How do I keep my family safe? I can't wear a mask at work. I can't socially distance at work. I work at a bar. Some places in the South have actually refused to allow their employees to wear a mask.
I think this is a tougher question, and I think it's going to be very difficult for you. I think you have to be very conscious of who you're talking with at your job. And if you can, try to keep a distance from them on your work, where you're trying to distance at least 3 feet from another employee or someone, and you want to have conversation less than 15 minutes if it's possible. And if you see anyone that's coughing or sneezing in an area nearby you, do not walk in that area. Because just from normal talking, they can have respiratory droplets that can remain in the air for 30 minutes or more. So if you see someone coughing or sneezing, I went to the grocery store this morning and I had a number of people coughing. I said, oops, I'm not going down that aisle and whatever. So I think you have to be very, very conscious about that. And then definitely you should, if you can, wear masks in a grocery store or a daycare. But then I think you have to ask who are you working for? You know, are people vaccinated? What's your level of comfort? Do we know what percentage? You don't have to know who's vaccinated, but what percentage of the employees are they vaccinated? And can your place of business tell you that? Otherwise, I think you may run a significant risk for possible passing and an infection to your family asymptomatically and not be aware of it.
May I ask a question, Dr. Kane? Is an employer liable if a patient gets infected because of no or lax rules?
I think, so what happens is occupational health can come in. And occupational health as an agency can say, were your work conditions conducive and safe for the people that you have hired? So if they're not meeting certain standards to safeguard their employees, they could be at risk for violation of that. And I think it also make that employer liable for a civil lawsuit. So I think employers have to be very careful now in this day and age about their work conditions and how safe an environment is for their employees.
Thank you.
Dr. Maxey, I think Dr. Gibson had a question, and I wonder if we could recognize Dr. Gibson.
Of course.
I think that, thank you very much, Dr. Walks and Dr. Maxey. I think that we all need to be mindful of the usual process of FDA authorization of new medications. It's incredibly important that every single treatment that is authorized by the Food and Drug Administration undergo rigorous testing. And those testings usually involve clinical trials. Clinical trials take time, and they require recruiting and collecting data, recruiting members, maintaining those members' data. All of that has to take place before the FDA can put its stamp of approval on a medication. And it's not rushed. It can't be rushed. People will try to rush it, but even the political strains have been unable to pry that loose. And I'm very happy to say that as a lifelong pharmacist, because we, just like physicians, embrace the whole ethic of first do no harm. We say first do no harm, second do no harm, third do no harm, never do no harm. And that's the best way for us to be careful about the medications that are authorized for us to use. Mindful also of the importance of nutrition. We really, really, really don't talk enough about nutrition and its importance as far as supporting and fortifying our immune systems. And that's critical. We need the zinc, we need the vitamin D, we need the vitamins B. We need all those supplements that are going to fortify our immune system. Thank you.
Thank you very much, Dr. David Stevens.
All right. We have certainly covered a lot of very critical points, but hang on, we still have some more things to discuss that we know are bothering you a lot, such as how can we keep our children safe with them going back to school? Now, we touched on this before, but very specifically, could we give some suggestions to our audience, Dr. Daly Garnes, how we can keep our children safe? And certainly, Dr. Kane, if you want to add any comments, you're welcome to do that. And I beg Yakini's pardon because she was supposed to ask that question. I will not do that again.
So to get to the first question, which we did discuss a little bit earlier, how can I keep my children safe with them going back to school? So I would say to do what's available to you. So, if you are able to get vaccinated as a way of protecting your children, if your children are old enough to get vaccinated, I would vaccinate them. Even whether the school is requiring it or not, teach your children, encourage your children, tell your children to keep their mask on and to keep their distance. Encourage them, make sure that they know how to wash their hands properly for 20 seconds with soap and water, that they know how to put enough hand sanitizer on their hands and rub their hands vigorously until it completely dries. Make sure that they know how to cover their coughs and sneezes. And don't send your kids ill. Try to encourage others that to not send their kids ill as well. We have relatively limited power over the actions of others, but we have power over our own actions. For your young children, getting them to wear a mask, it's something that you want to work on before school starts. Sometimes you can do things with very young children, like having toys that are wearing masks, which normalizes it for them. As I said before, wearing your own mask will make it normalized for them. So those are ways that I would say to keep your children safe. In terms of your older family members, and then with the unvaccinated children. So again, if those older family members are eligible and able, I would encourage them to get vaccinated. Because again, if your children are too young, they can bring things home. You also have to remember that the adults in the home, even if they're vaccinated, can bring things home too. So encouraging everyone in your household, if you've got unvaccinated children, to do what they can to protect themselves when they're outside of the home. And in terms of protecting your newborns and preschool children, again, the same things that I just mentioned. So obviously your newborn baby and those children that are under 2 cannot wear a mask. So it's going to be that much more important for you to be very careful about who you have them around, and for the people who are around those children to protect themselves so that they're not bringing anything home.
Dr. Garnes, does wearing a mask by a child cut down their ability to breathe and get an oxygen? And does it raise the toxic level of carbon dioxide in any way?
It does not. And I think honestly, our children have been better about wearing their masks in many cases than we have as adults. They've adapted very well.
Thank you very much.
Yakini, with the follow-ups, please.
Okay, before we move on, back to the kids and the masks, there was a question about kids and bullying that somebody had posed to the Black Health Trust. From a doctor's perspective, how would you advise us to help our kids and kids in the community understand that masks, that even if their friends aren't wearing masks, that it's okay for them to be wearing a mask if that's what their family chooses to do?
So I think this really is a fundamental parenting question, because bullying can happen based on anything. So I think one is equipping your child with the information for why we are as a family are making the choice to continue wearing our masks. So your child can express that information, and equipping your child the way you would with dealing with bullying in general. To not give the person who is attempting to bully them a lot of attention, because that just encourages it. For them to express, this is why I'm doing it, to move away from the situation. If they need to escalate it, to authorize them to escalate it. But the way to deal with bullying in this situation is going to be the way to deal with bullying in any situation.
So much for that.
Yakini, go ahead.
Sure will. Next we have, will I need a booster? And when do I need to get a test? If I feel like I'm sick, when do I need to go get a test? And the follow-up to that would be, wouldn't I be better off getting COVID-19 than taking the vaccine and just getting the natural immunity?
So first of all, we don't quite know exactly about the booster vaccine and whether you need one or not. The presumption is we probably We'll need a booster vaccine sometime in the future, but we just don't know the timing of that. We're trying to see how long we have immunity from the vaccine. Does that vaccine remain effective for 9 months? Does it remain effective for 12 months? Like we see with the influenza vaccine, we just don't know just yet. And will everybody require a booster vaccine? Maybe it may only be just for seniors whose immune antibodies may wane quicker than others. So we don't know the answer just yet. They're doing an investigation related to this. And we may be fortunate that the vaccine may last more than 1 year. So they are monitoring that very closely, and they're monitoring the level of antibodies to see how effective it is. And this Delta variant may have changed things in terms of the determination for a booster vaccine. So right off, we don't know the answer just of yet, but hopefully we may get that answer by the fall, early fall. So when do I need to get a test? Definitely if you any symptoms related to COVID-19, fever, cough, shortness of breath, especially loss of taste or smell. You can have some symptoms that sound like just a regular cold, where you may get nasal congestion or sore throat. You may even get some GI symptoms, such as nausea, vomiting, or diarrhea. But if you don't have allergies and you're getting these symptoms, that may be the time to please get yourself tested. And would I be better off getting COVID-19? Definitely not. We have what we call the long haulers associated with COVID-19. Individuals that are prone to chronic complications from getting COVID-19. You may get a chronic fatigue syndrome, where you're so tired, you're so exhausted, you can't even go from your bedroom to the bathroom. And 85% of the people who get this chronic fatigue syndrome are unable to walk because of the exhaustion that they're associated with. But other side effects, such as difficulty in concentration, you get this dense fogginess of your ability that can last for months. You're just not sharp anymore, And wow, I can't even remember someone that I've known for years. I can't remember their name now. I may have difficulty being able to calculate my change when I'm buying a purchase. I may have loss of hair. I may have chronic shortness of breath where I didn't have it before. I may now have developed some chronic arthralgias, joint pains, discomforts that I didn't have before. And so you can have these long-term complications, and especially if you're young, in your 20s and 30s, you're getting symptoms that we would expect for people over the age of 65. But it's like you become a senior overnight. So no, you are not better getting COVID-19 than taking the vaccine.
As a follow-up to that, there have been a couple of questions in the chat related to what is a strong immune system? How do we know if we can withstand pathogens? Questions along how to, are there nutritional ways to strengthen the immune system? And not stated like this, but I think part of this also is, again, the question is the vaccine worth it? So I'll ask Dr. Daly Garnes to address that first, and then Dr. Kane, if you could follow up.
I would say related to the nutrition that, yes, there are certainly things that we can do with regard to our nutrition to strengthen our immune systems. So eating a good, balanced, healthy diet, particularly with your fruits and vegetables and with a variety of fruits and vegetables, because that way you're going to get a variety of vitamins and minerals that will allow you to fight things off. Someone mentioned vitamin D, zinc levels. Those are things that you can have checked by your primary care provider. And you can take supplements and also eat foods that are rich in those sources. Those are things that can boost your immune system. Now, to know whether or not you have a strong immune system, some of that's going to be related to your history. Are you somebody who gets frequent infections? But I will say that, I certainly encourage you to do the things to boost your immune system, because that's going to help you in general. And as one of the chat questions mentioned, it's going to help you fight infections. It can also help you fight off cancer. So that's an important piece. But there are people whose immune systems are completely normal that are still getting COVID. And so I wouldn't say that this is an alternative to doing other things that you can do to protect yourself, including getting vaccinated, including wearing a mask and distancing.
I'd like to ask, I know Dr. Kane is getting ready to comment, but could you also comment on the new emergency authorization for prophylactic use of monoclonal antibody as well?
So recently there was an addition. So you've probably heard, this is also the antibody cocktail that former President Trump received, has been approved recently. So it was approved to give to people who were infected with COVID to prevent their needing hospitalization. So that's what it was originally authorized for under emergency use authorization. That emergency use authorization has now been extended for people who either cannot be vaccinated, people who are in the midst of getting vaccinated, but they are not yet fully vaccinated, that this antibody can be administered as a way to prevent infection in persons who have been exposed to COVID-19. So that is in the setting that we know that there is a known exposure. It is not approved for someone who is not known to have been exposed.
Thank you. I think those numbers reported were pretty big in terms of its efficacy. Is that correct?
I believe so. I feel like it was in the 75 or 85% range.
75, I think it was.
Yeah.
So I think the thing for people who may not know what monoclonal antibodies are, so when you have an infection, a lot of times our body has protein substances in it where it develops and builds off antibodies in order to protect you from the infection. And so the monoclonal antibodies are what are man-made antibodies that a pharmaceutical company or company can produce that are antibodies very similar to the antibodies with a person who has a COVID-19 infection can develop. And so they make it man-made, but of course these antibodies can be expensive and they don't last as long in terms of providing immunity. But when you give someone a vaccine, it takes 2 weeks minimum for that vaccine to stimulate antibodies in your body system. And a lot of times when someone gets sick, they don't have time to wait 2 weeks for the antibodies to develop. They're so sick that they may succumb. So these monoclonal antibodies have already been developed as an infusion that I can give someone. So as their viruses are building up in the body for an overwhelming infection, you have these instant antibodies preventing them from gaining a major threshold in your body and are that can be life-saving. And the treatment has to be given in a very short period of time once you develop symptoms. If you give it after the 8th day of symptoms, it doesn't work. So immediately, if someone has symptoms, they need to be tested immediately in order to get on the protocol with these monoclonal antibodies.
Thank you, Dr. Kane. And then we are going to now turn it over to Simon to take us through the next slide.
What can I do as an individual to help my family, friends, and community be safer during the pandemic?
So, Dr. Kane, can you, as a public health person, can you help us with that one?
So what can an individual do to help my family, friends, and community be safer during the pandemic? I honestly think the number one thing that you can do is to make sure, if you are eligible, to get as many members of your family vaccinated. I don't know how many people caught the story of the nurse, I think from Georgia, just on TV, on CNN, about within the last 2 weeks, where her mother was a young grandmother in her early 50s, no major medical underlying conditions and everything. And she could not get her mother to be vaccinated. And her mother, unfortunately, developed COVID-19 infection and got hospitalized and unfortunately died. And so the deal was, she felt so guilty because she couldn't convince her mother to be vaccinated, and made it clear to her father, who was still married to her mom, I'm not going to have two parents die on me when I know your life could be saved, and made sure that her father convinced him to get vaccinated. So I think what we have to do is try to, on the best of our ability, listen and read the science, encourage your family and friends to look at the science and not be afraid. There's a tremendous amount of leadership, and there've been a lot of courageous people in our backgrounds, and they need to, if possible, have some responsibility for the community as well as themselves. And I think that's the critical thing for them to do, if they can, but to listen, stay frequent on the information, get vaccinated, understand those other risk mitigating plans, such as masking when appropriate, washing your hands, using proper hygiene out there. Because you may go to the grocery store, you got your hands on the grocery carts. So when you're out in the public, remember to wash your hands before coming back into your households.
So Dr. Kane, can I ask you to expand a little bit on the before coming back into the household piece of that? I had a friend who had to be a frontline worker and actually had to work in a grocery store where he couldn't socially distance. And when he came home, the real boss in the house, the woman of the house, made him go through a procedure. It's probably something that Admiral Brewer would put into place. It was, before you come in the door, you're going to do this. You're going to take that off. You're going to watch this. You're going to go in this room. Maybe there are some habits we can get into to help keep our community safe. And then one other thing I'd like you to comment on is, what about helping people check the information they get? When you read something on Facebook and Twitter, could we maybe refer our family members to double check it on the NIH site or double check it on the CDC site? And so we're not telling them that don't believe that and that's crazy. We're just helping them to double check it at a different kind of a reliable source. How about stuff like that?
So I think it's important that they can try to look at, I think the CDC site's a little bit more easier to read and understand as a layperson than maybe the NIH site. So I really encourage the CDC site, but I also know that we have a number of medical associations, like the National Medical Association, where you may be looking for some information, or American Academy of Pediatrics, American Academy of Family Practice, or American Association of Physicians. So there's some other locations, I believe, that you can look at in terms of data. And even some of our leading newspapers have some good health information, whether it's Washington Post, New York Times, Los Angeles, Boston Globe. Those are some reliable newspapers that will report out, I think, some great information and sometimes summarize a lot of the science and look at their science sections that you may see there as a result. Now, in terms of the person coming into the household, I'd like to remind people that a lot of us drive in our cars. And so we open the doorknobs of our car, we use the steering wheels, we open the door handle to get out of the cars. And I think that those should be wiped down on a regular basis. I don't think it has to be done every day, but at least a minimum of once a week, very thoroughly. And I especially think that when you come into your household, that when you're opening that door and that door's being opened by frequent people every day, and their hands may not be washed, it's important to wash the outside of your doorknob. And I just believe inside your house, it doesn't hurt for you to take a moment, wash down your refrigerator handle that you open, or your cabinets in your kitchen that you open. You go to your ladies or restrooms, wipe down that toilet handle that you flush. Or I'm in the kitchen sink and I'm turning on my water, wipe down the water faucet and everything. So it just takes like 5 minutes of your time during the day that you can just wipe it down once a day. And it keeps that amount of any bacteria or germs down to a certain level where it's less easy to spread. And if you're coming from a healthcare, a hospital setting, I think it's so important that when you come into your home, you take your clothes off, put it in a garment bag or something so it can't be exposed to anything, and try to wash your clothes immediately or make sure it's not in contact with any of the other clothing items if you're coming from a healthcare setting with your clothing items.
Dr. Kane, I want to ask a question with a bit of a twist. We had a task force that looked at policy that we would endorse from the Black Health Trust. And we elected to line up with the pronouncements of the National Medical Association and vaccines, et cetera. But a number of quite esteemed colleagues have some not mainstream treatments that they recommend. I'd like your comment on the use of ivermectin. I've had that question come up clinically in my practice, and I would just like your opinion on it, and also Dr. Garnes, if she would.
So what I can tell you is that I think the jury's out. We don't know whether it's a very effective product or it's a product that's not so effective. That there's still been a lot of review and research related to ivermectin. And I think one large study just recently got stopped because they felt there wasn't enough evidence to say that it was a good product. But I will just say there's still a lot of studies looking at this data, but I don't think it's been completely finalized whether it's an effective or non-effective study. So where am I going with this? You may see some cases where it may work, but you may see some cases where it doesn't work at all. And so until you've been able to methodically look at these cases thoroughly from a control standpoint, I think you can't 100% say it's an effective product, but I can also, at the other side of the coin, I can't say that it's not. So it is still being studied, to my knowledge, on an emergency authorization related to how effective it is. But Dr. Garnes may know better.
Dr. Garnes?
So related to ivermectin, generally the things that I've seen have mostly been outside of the US. There was a study that was published in a pretty good journal recently where they looked at the use of ivermectin in preventing COVID-19 infection among healthcare workers. And they did seem to have a pretty good effect. I think some of the issues related to ivermectin is that the studies are very different from one another. And so it's very hard to kind of pull them together and make a blanket recommendation. The quality of the studies varies as well. The settings vary. Where this all came from is that ivermectin seems to work against the virus in the lab. But whether that translates into levels that are adequate within people still remains to fully be seen.
So none of that, though, means that we should not continue to recommend that folks get vaccinated. I didn't hear either one of you say that, Dr. Kane or Dr. Garnes.
So there's a difference between the looking at the vaccines versus looking at ivermectin. So the vaccines were put on a very rigorous clinical trial, had to be associated with COVID-19, that they followed from the front to beginning. Our problem with ivermectin, that a lot of the studies were not designed from a rigorous standpoint. So we have to look at different studies that didn't have that same rigor, trying to determine was enough methodology put in this research project to say, I can make a difference, that this is better than placebo. And so, and one of our other issues is most of these studies are outside our country. So they look at things differently and they make interpretations differently. So I feel way more comfortable about the vaccines because I know that they were on the rigorous study and compared to placebo to see a significant difference in large enough numbers, unlike what we have seen with ivermectin.
And
So one last quick comment on this, Dr. Maxey. I don't want to just keep on beating on it, but I think it's important for us to recognize that, as Dr. Maxey said, we do have folks that are part of the Black Health Trust who have varying opinions. And from what Dr. Daly Garnes and Dr. Kane said, they're both paying attention to what's going on with studies and with even studies outside of the country. So there isn't, I don't want anyone to think that there's a blind, just everybody go get vaccinated and we're not looking at anything else. Everybody go get vaccinated and we're looking at monoclonal antibodies and we're looking at studies from around the world on ivermectin and we're looking at what's coming out of the CDC and what have you, because that's the only way that you can really give accurate, current, trusted information is by looking beyond whatever the science is just today.
And in addition to what Dr. Walks is saying, we have to be very careful what we recommend. And we recommend something that is vetted rigorously. That doesn't mean something else won't show up next year or in 6 months. But right now, we're going with the evidence. And I'm very pleased that the FDA has granted emergency use to a new monoclonal antibody that can help with prophylaxis in people who've been exposed or who may not be symptomatic, but have been exposed, et cetera. So I think right now we as an organization are not recommending ivermectin, but we recognize that it still bears more research. And let's go back to our questions.
I just want to add one other point. There was a huge study that was out of Egypt that have resulted in ivermectin supposed to be very effective, greater than 90% efficacy in terms of people with COVID-19. But 2 weeks ago, this major study was withdrawn, supposedly related to some concerns about the methodology of the study or other results. We don't know all the details. So when I tell you is we're trying to capture as much data as we can. And we have to look at all studies that are outside this country because we don't have the same significant number of studies here in this country. But the jury, I think, is still out for us.
Well, thank you, Dr. Kane. Dr. Neighbor, I think we have some more questions we want to get to.
Yes, thank you. We will now go back to Yakini.
So Dr. Garnes, could you tell us what is the effect of each of these pre-existing chronic conditions on my vulnerability to COVID-19 and its variants, and what can I do about each one? If I'm overweight or obese, if I have poorly controlled diabetes or blood sugar, if I have high blood pressure, which is hypertension, stress and depression, and lastly, if I'm a cigarette smoker and I can't stop smoking, and what if I smoke other things, like what if I smoke marijuana or anything else that I might light on fire and put in my lungs?
So the first thing I would say is these conditions, they don't make you more likely to get COVID. They make you more likely to have severe COVID if you get infected. And so in terms of what you can do, so if you are overweight or obese, working towards decreasing your weight, even if, if you're obese, even if you don't get down to not being obese or not being overweight, the less weight that you have on board, it's to your benefit. So, when we talk about high blood pressure, for example, even losing 5 pounds, 10 pounds can make a difference in your blood pressure. So just moving in that direction, doing things to move in that direction, being more active, eating better, even if you don't necessarily lose the weight, just the going through the process of being more active and eating those things that we talked about earlier that can strengthen your immune system can put you in a better situation. But if you're able to lose weight, that can help also. In terms of poorly controlled diabetes or blood sugar, so people with diabetes that is controlled are not at increased risk for having bad outcomes with COVID. So the important thing is to do what you need to do to get your diabetes under control. Work closely with your care provider to make sure that you're on the right regimen, and make sure that you take your regimen. Take into account, take the advice of your provider with regard to your diet, but bring your diabetes under control. It will make a big difference. Same thing with your blood pressure. Again, if you have the diagnosis of hypertension or high blood pressure, but your blood pressure is well controlled, you are not at increased risk for having problems with COVID. So take your medicine, do the other things that you can do, exercising, losing weight, avoiding sodium. Those are all ways to keep your blood pressure under better control, which will help you, if you were to get infected, come out better on the other side. Stress, depression, again, these things can also, they weaken your immune system. There is treatment for depression, and it's multi-pronged. It's not just medicine. We as a community, we have a lot of stigma associated with mental illness, but we're all human, and our brains are a part of our bodies like the rest of our bodies. So if you find yourself dealing with high amounts of stress or depression, seek the care that you need. You can start off with your care provider. You can talk to a therapist. You can talk to your clergy. There are lots of different ways to address those things, but it's important to address them because, again, it will put your health, your overall health, in a better situation. Smoking anything, whether it's cigarettes, whether it's marijuana, or anything else, as you mentioned, causes damage to your lungs. And so that damage puts you at increased risk. You've already got extra inflammation in your lungs. Part of the problem with COVID is that even after the virus itself may be controlled, it kicks off this crazy immune response that your body takes a long time to get back into whack. Well, if you're smoking something, you've already got extra inflammation going on in your lungs. So I would avoid doing it. And if you're having trouble, again, there are things that the medical community can do to help you quit smoking, to help you quit smoking whatever you're smoking. So I would definitely seek help from your care provider if you're having trouble doing it on your own. Most people are not able to quit smoking cigarettes on their own. So don't feel like it's a failure if you're not able to do it. Seek help. It's out there.
Thank you so much, Dr. Burns. Dr. Walks?
Thank you, Dr. Maxey. We have several questions in the chat, and I wanted to know if Dr. Neighbor-Stevens had a chance to look at those, or should we go ahead with the other questions first and then get back to the questions in the chat?
We actually have one last question that's going to address some of the things in the chat. And then, yes, there is definitely a question in the chat that we will come back to regarding vaccine safety. So
okay, then
we will throw it to Simon.
Simon.
I think everybody can relate to this. Can I safely reuse my mask and other PPE? Is it safe to travel by plane, bus, train, or car, assuming in the car with other people?
We will ask Dr. Kane if she will start us off on that discussion, and then ask Dr. Daly Carnes if she'll give us her comments.
So it depends on what type of mask you're talking about. Can I safely reuse? So if you have a cloth mask and you have the ability to wash it between usage every day, you can safely reuse a cloth mask. But if you have one of those paper masks, like the surgical mask, we're asked that you not reuse it after 1 day service. And then it depends on your personal protective garment. You know, like if you're in a healthcare field and you have a cloth type of personal protective equipment, we don't reuse it. But if you have a clothing, sort of like a cotton or woolen type of gown, it can be reused if it is washed in the high standard temperatures as a material or laundried or sent to the cleaners. That can be reused. Now, is it safe to travel by plane, bus, and what's that? Let's see, bus, train, or car? So I think that you are at higher risk of traveling by plane, bus, and train versus in a car. And I say that it also depends on the distance of the flight, but even more important, you may not realize, is of the connections when you're traveling. So if you're traveling and you have a connection and you have to be inside an airport, if that is an international airport and there are tons of people traveling through there, and your length of time that you have to wait in an airport at an international flight can put you at risk for exposure to the Delta variant. And it's so critical that you wear a mask once you hit an airport, even while you're in the plane until you're out of the airport setting, that to reduce your risk. But let me say this again. Once you hit an airport, any international large metropolitan city airport, you have to wear that mask as soon as you get into the airport and keep that mask on for your flight. So I'm in an enclosed plane, and if I feel the need to drink or eat something on that plane, remember you're in an enclosed airplane. And so people who may not be vaccinated can be sitting and eating for over 15 minutes, releasing respiratory droplets in the air. And wow, have you seen how many people, once they get on their plane, is refusing to wear their mask or just taking it off? So I think those are the concerns for the planes, the buses, and the trains. Now, if you're in a car, you stand a better chance of going with people from your same household that you're traveling in a car, so that you may be safer, and also having a better idea of the people who are vaccinated traveling in a car as family members compared to any other setting. So I believe the safest is the car.
Well, thank you. Dr. Carnes, do you want to follow up?
I don't really have anything to add to that. You know, I'm assuming that we're talking about in terms of the masks and PPE that are people outside of the healthcare setting. For people who are within the healthcare setting, the people who are employing them should be taking care of providing their PPE. Things in general should be better than they were because the supply chains have been changed. We know there are issues with supply chains with other items across the world still. There are, for the mask types that are used within a healthcare setting, there are protocols that some institutions may take to make those able to be reused, but those are very specific and database. It's not something that I would take on my own to do.
But
I
as
wanna
a
ask a
follow-up,
question.
Dr. Garnes, there was a question in the chat about whether or not lay people in the open community, whether or not they need to use KN95 or N95 masks. So could you just make a comment about the different types of masks available and their effectiveness?
And let me add on to that. As a healthcare provider, we wear masks, but we were wearing these shields. And we have a number of dialysis people on the phone and doctors and nurses on the phone. Do we need to also go back to shields in our practice, given the variants?
So what I would say to the first question, there was obviously a concern initially when, over a year ago when this emerged about lay people wearing N95 and KN95 masks. What I would say is this, one, the issue then was that we didn't have enough N95 and N95 masks for the healthcare workers that were taking care of the patients. And so, we're in a situation where we can't provide it to the people whose job it is to take care of the people who are sick so that they can protect themselves, then yes, that would be an issue. I don't think that is currently an issue. Things that I would take into account. So the KN95 is basically a high particle protection mask. It prevents 95% of the particles, and I forget what the measurement is, but very small particles from entering the mask. So an N95 mask is the US standard. The thing about an N95 mask, for you to get its full effect, it has to be what we call fit tested. That means that you put it on and someone actually tests to make sure that particles are not entering the mask. And that's not something that most lay people are going to have access to. So just keep in mind that you don't know how well your mask is fitting. You may not get the full protection that the mask can offer outside the healthcare setting. The KN95 is a similar version to the mask, generally not fit tested because it's a version of the mask that was actually developed in other countries. But generally for healthcare workers that are in contact with patients with known COVID infection, the N95 is what they're using. To get to the face shield. So, the thing is this, that we know that COVID can be transmitted if the virus comes into contact with any mucous membrane, and that includes your eyes. So definitely when you're coming in contact, so for healthcare workers who are coming in contact with a known infection, they are still wearing eye protection. And I would say for many of us, even for other viruses that are transmitted that way, it is helpful to have some sort of eye protection to protect yourself in those settings. But a lot of institutions are no longer requiring the face shield for patients in general.
And let me just say that the face shields, though, for protection of COVID-19 are not as near as good as having the surgical mask. You're probably losing about a 20% decrease, lower efficacy with the face shield compared to the face mask, okay?
When it's used
for COVID-19 from the respiratory droplets. So optimally, the face mask is the best.
So we have, even though I know we've covered some of this early on, we have another question in the chat about the safety of the vaccines and side effects from the vaccines. A lot of issues are in there with respect to what happens after I take it. Will I get some long-term bad outcome? Will I be sickened by the vaccine? So I wondered if you could both address that, Dr. Daly Garnes and then Dr. Kane.
So as we mentioned before, so there have been these surveillance studies that have looked at people who have been vaccinated. And, we now have millions of people across the world who have been vaccinated. And yes, we have seen some very rare, severe side effects. And I know one of the things that was brought up in the chat is that recently Guillain-Barré syndrome has been associated for the Johnson & Johnson vaccine. Guillain-Barré has been associated with other vaccines in the past. It remains very rare. So what does that mean? You know, as I mentioned before, there is nothing that we put into our bodies that is not without risk. So there is always the possibility, if you pick up an apple, that you could get a bacterial infection from it. There is always that risk. But what we know is that it took this many people to get the vaccine for us to see this effect. So it's very rare. Now, I can't predict whether or not you're going to be the person to get that, but the likelihood of you having one of those severe effects is very, very, very low.
Thank you, Dr. Daly Garnes. Dr. Kane, any other comment about the safety of the vaccine and vaccine side effects?
So no, I think Dr. Garnes has really highlighted some of the issues associated with the vaccines. But when we look at the rarity of it compared to the harmful complications we see with the COVID-19 itself, it is so low that the benefits of the vaccine way outweigh with its side effects, the major complications associated with COVID-19, and the fact we don't want to forget that it is life-threatening and you can lose your life.
Thank you very much, Dr. Kane. Dr. Neighbor-Stevens?
Thank you so much. We have talked about what we can do to protect ourselves and our family. There was a question that I thought was a very good question about what can we do as individuals in our community. And I think that it's very appropriate for us to have a few comments about what we can do to make our local communities better. I'll start with Dr. Kane, since she's a public health person, and then invite Dr. Daly Garnes to also respond.
So repeat that question, Barbara. I'm sorry.
As individuals in our local communities, what can we do to help make our families and keep ourselves safe and improve the safety in our communities?
Well, I think that we need to try to promote dialogues. It's just not enough to make those recommendations just within your family. You want to expand conversations with all of your friends. If you're a faith-based going person, you want to promote dialogue, whatever faith-based entity that you attend. If you belong to any civic organizations or women groups or men groups, sororities or fraternities or anything, you want to promote that type of dialogue so that everybody can be part of this decision making, and we try to want all of us to be on the same page. And it doesn't hurt to express your sentiment or your concerns to your city council individuals, your political leaders, what your concerns are, your school systems, what your concerns are, your employers, what your concerns are. And so I think that's important that we don't stay silent. People need to hear from us what we think are important. I think it can help address the vaccine hesitancy.
Dr. Daly Garnes?
Yeah, I agree with Dr. Kane is, making sure, I think one of the things is not passing judgment on people for the decisions that they're making, but really, asking, what are your concerns? What are the questions you have? If you can refer your friends and your family to reputable sources. I think there was one question in the chat about, there are people that are hesitant, to trust the government. And so that's why, we were referring to some of the other non-governmental organizations like the American Academy of Pediatrics. There are other medical organizations. There are academic organizations. There are community organizations. So there are lots of places to get reputable information. So if you can help, those close to you and those in your community identify those reputable sources, Hosting forums where you have people who are able to give accurate information to a broad segment of your community. Advocating, as Dr. Kane mentioned, for the things that are needed in all of the places where you interact, so that you can have, and the people around you can have what they need to stay safe. Those are the things that we can do as members of our communities to encourage the safety of all of our members.
And Dr. Kane, we at Black Health Trust have demonstrated that we are providing current and even information that may be needed in the future. And we have a question in the chat related to something that is going to be a burning topic of discussion, I'm sure, in the next few weeks. And that is, what is your thought around mixing and matching different vaccine products? In other words, if you receive Pfizer and a booster comes out made by another manufacturer, should we consider mixing and matching the original vaccine product with the boosters once they become available?
So right now, actually, NIH has been doing studies related to that since, I believe, around early June, trying to make sure, does it make a difference if I got antibodies produced by one vaccine, and if I get another type of a vaccine, will that continue to increase those antibodies, or will my body perceive this, even though it's an antibody, but because it's slightly different, will my body perceive this as something I can generate more antibodies, or will it not produce the effect we think it will? And so there actually have been doing studies related to this for the last couple of months. I don't know the answer to that. They have not revealed it yet, but they're actually looking at studies to make that determination to see whether they can do it or not. And I know those studies have been going on for a couple of months at least.
So Dr. Neighbor-Stevens, I want to go to a couple of our people here. There's a question I have regarding children. And my concern with children is, can they get the long haul syndrome, and what does that affect? And I asked that question of both Dr. Daly Garnes and Dr. Virginia Kane, and then I'm going to call on a couple of our other physician guests.
So I don't know if Dr. Gaines, you want to go first?
Yeah,
aren't you pediatric too?
Yeah, I do pediatric infectious disease in addition to adult. I have seen recently, there's starting to be some studies that have reported some cases of long haul syndrome in children who've been infected with COVID. It's something that we're still learning about. I haven't seen a lot of information about it yet, but I have seen it mentioned. So it does seem to be something that can occur. I don't know what the frequency so far.
Thank you.
I think the thing that is not so much the long haulers, I think we have to be worried about too, is that there's this multi-system inflammatory syndrome that we see in children, so that when they get the COVID, it seems like this virus impacts almost every different organ in a young child, making it a very severe condition. And so, let alone they're developing the long-term complications, because this virus attacks their heart, their lungs, their kidneys, their brain, skin, eyes, and the GI tract. And they don't know exactly why it is, but it's so serious and even deadly. They really have to look out for any stomach pain, bloodshot eyes in these young kids, chest tightness, so they're complaining that their chest hurt, diarrhea. The kids seem to be very, very tired. They don't have the energy like they used to. They may have a headache, low blood pressure, neck pain, a rash, or vomiting. And they're not going to have all of these symptoms, But these are some of the things that you have to think about, and always remember, and this is for anybody, when should you seek emergency care? You know, if anyone's experiencing any trouble breathing, don't wait till the next day. You get them seen immediately. If they're having persistent pain or pressure in your chest, hey, I'm just going to lie down for about 30 minutes or so. And then if I don't feel better, I'll go to the hospital. No, you're going to die in your sleep. So if you're having persistent pain or pressure in your chest, you need to seek out medical attention. If someone, a loved one, appears to be more confused, they seem lethargic, they don't want to wake up or stay awake, or even if they look like pale in any manner, get them to the emergency room, you call 911.
So as a follow-up, there's a noted pediatric cardiologist on the call. I was wondering if Dr. Swilley would make a comment on the long haul syndrome in children. Can you unmute her if she's on?
I don't see Dr. Swilley.
She's in my lower right-hand corner.
Oh, there she is.
Dr. Swilley, are you on? Okay, go ahead with the other question you had, Dr. Walks.
There was a question in the chat, basically just what about gloves? So Dr. Kane?
So, gloves can be important barriers if you're, someplace and you're having to touch some surfaces. So gloves can be very important depending on what setting that you're using it in. But you still have to, you should wash your hands before you put those gloves on, and wash your hands even after using the gloves. But if you are especially if you're immunocompromised in any kind of way, I may be going to the grocery store, and instead of using your bare hands and using a hand sanitizer, putting your hands on a cart, you may prefer to wear gloves.
I think the thing to remember about the gloves is that you have to pay attention to what else you're touching. So, you don't want to make sure you're not touching your face, and the gloves may be a reminder to you to not touch your face. And then just remembering they're not perfect. They are porous to some degree. So the point that Dr. Kane made about making sure that you wash your hands after you take them off is really important.
So I just want to make sure that we're clear to folks, though, that unless you have broken skin, you have a cut or something on your hands. Skin is a pretty good protector. You just have to keep washing it and washing it and washing it.
Yes. So just even soap and water is critical, important in terms of providing perfection for this. And I'm not talking about no quick, wash my hands in 1 minute. You gotta wash it vigorously for like 5 minutes or so in terms of washing your hands and keeping it clean.
So if you actually know the alphabet, you should go through the whole alphabet while you're doing all of that.
So we've been talking about pediatrics just as we draw to the top of the hour. If I were taking care of a 100-plus-year-old mother, I want to know what I would do in terms of the way I fed her and supplements I'd give her. And before I go to the doctors on the phone, I'm going to ask Admiral Brewer how he takes care of his 100-plus-year-old mom.
Okay, thanks, Dr. Maxey. My mother and I have not had the cold or the flu, and I just put this up in the chat, in over 10 years. My father majored in nutrition at Tuskegee. He had a Bachelor of Science degree in that, so I've always been focused on it. Anyway, here's our protocol. we take elderberry syrup. Now, everybody can't take elderberry syrup if you're immunocompromised with lupus, rheumatoid arthritis, etc. But it enhances your immune system. But one of the elixirs we take is also black seed oil, which is also good for your respiratory system, and manuka honey. Manuka honey is K factor 16 or higher, or UMF 15 or higher. It's antiviral and antibacterial. What's important about that is it is made in New Zealand. And when they had COVID, when COVID hit, Manuka honey sales soared. So that was one of the factors that impacted their ability to fight this virus. The other thing is high antioxidant foods. Broccoli sprouts, which are the highest vegetable with sulforaphane as an antioxidant. Blueberries, of course. But we also, if you want to be the best, you study the best. And that is the longest living women in the world are Okinawan women. And one of the staples in their diet is purple sweet potatoes. So we eat purple sweet potatoes, which have 150% more anthocyanins than blueberries. And then, of course, green tea, matcha green tea, and hibiscus tea. Those are the two highest antioxidant beverages. We drink those throughout the day. If you go to Japan or anywhere in Okinawa or Asia, they're constantly drinking green tea. And for the ladies in the audience, green tea plus squeezed lemon, which enhances the EGCG in the antioxidant in green tea sixfold, plus cooked mushrooms, 80% reduced risk of breast cancer. So those are some of the things we do. We do all the seeds, hemp seeds, flax seeds, etc. And that's, I make these super smoothies with all this for my mother and myself. And it's working so far. It will protect you. Nutrition will protect you. I'm not saying it's like a drug, but clearly you want to prevent as much as you possibly can any infections.
Well, thank you so much. Any comments, Dr. Kane, Dr. Daly Garnes, or co-moderators?
I just know that I think nutrition is so critical. I think the other thing that's critical people may not realize is that you have to get the proper level of sleep in your body, and you have to be very well hydrated from hydration, water, and exercise if that is possible, to get that exercise, because it only strengthens your heart, your joints, and other things. So just not nutrients alone, but nutrition is critical, but also sleep, which we don't do a good job of. Have your body well hydrated in terms of drinking plenty of water every day, and don't forget to exercise. And we know that if you can exercise just 15 minutes a day, you've extended your life 2 years. If you can exercise 30 minutes for 5 days out of the week, you've extended your life easily by 3 years. But you're also at risk for having less complications with these other underlying conditions.
Thank you, Dr. Kane. Dr. Daly Garnes?
I really don't have anything to add. I think, the importance of taking in antioxidants and, all of the things that we've discussed in terms of your general health is really helpful.
Well, thank you so much, Dr. Barbara Neighbor and Dr. Ivan Walks.
Well, I'll just summarize as I most often do, which is we need to use common sense. Don't forget the mask. Don't forget the safe distancing, whether you're inside or outside, and good hygiene.
And one of the things that I don't think we spend a lot of time talking about today is mental health. Mental health is a huge part of what's going on within the pandemic. Folks need to be, life is a two-person lift. I love those boxes when they say one-person lift or two-person lift. I think very often life is a two-person lift, and all the places where we can get support, particularly from our social groups, our families, our churches, other places we go where people care about us and people want to know how we feel. People want to know what we're worried about. And from those people who really are going to give us information. The last comment I want to make is this. Just because it happened to somebody else doesn't mean it's going to happen to you. And just because it didn't happen to anybody you know doesn't mean it can't happen to you. People will tell me, well, I don't know anybody that's gotten COVID. Yeah, keep it that way. Get your vaccine, wear your mask, wash your hands, keep your distance. I mean, there's so much of this kind of, I hear something, I read something, so I think it applies to me. The things that apply to all of us: get plenty of sleep, eat right, do those general things that are going to make your body stronger. And if you need someone to quote a passage of, pick your book, Bible, Quran, anything, they all say that we're supposed to take better care of ourselves. These bodies are ours for us to protect. And I just think it's really important for us to start at that basic part. The one place I will add to the places that Dr. Kane said to make your voice heard, make your voice heard at church. Talk to your pastor. Ask if you do have good information. If you're a healthcare person or someone that knows a healthcare person, take them to church to give a talk at your church to help people understand about being safe and keeping safe. So thank you, Dr. Maxey.
Well, thank you so much. I'd like you to help us put together a program on mental health, diet, and the GI tract in the future. I think there's a lot of meat there we need to talk about of how that affects mental health. And to David Brewer, I have a problem with your recipe. I get stuck on the Manuka honey. It's so good. I have to remember to put the other stuff in it, but it's good stuff. Thanks, everybody. Thank you, Dr. Kane. Thank you, Dr. Janine Daly-Garnes. Thank you, Simon and Yukini, for your questions, and our co-moderators and everybody for attending. Have a great, great rest of your weekend. Have a good day.
Bye-bye.
Bye.
Thank you.
I'm sorry, I forgot Dr. Pointer.